So we're going to do cases, and I'm going to move quickly. This is a 7-year-old Amish boy who comes in with profound neurologic abnormalities, torticollis, dystonia, and a rigid abdomen. The attempts to fix him involved benzos, huge doses. This 7-year-old took about 16 milligrams of Versed. The priorities here was he's seizing, stop it, make sure it's a seizure. Quite simple. You've got an abnormal motor movement kid, comes in, no history that's going to help you. Quick history while you take his rescue drugs. There's really no secrets here. The Amish community near Syracuse is pretty cloistered, and there's not a lot of bad things going on. Not much help on this slide. The interventions we provided were simple. We gave him more benzos, obviously. He was still breaking through. He was loaded with phospheni for his seizure. We went over this before with the article I went to. No effect. And then he was loaded with Keppra, but again, no effect. So where are we? I haven't done my job. I have to continue intervening. Secondary decisions, we gave him multiple doses. I talked about 16 milligrams of lorazepam, which would put us on a vent. 20 per kilo of phenobarb was given. Obviously, what's the side effect that we're going to worry about? He'll become apneic. He stopped breathing. We gave him VEC, and we intubated him. I don't consider this a negative clinical moment, because if you intubate someone, it just means you care. It's like a Hallmark card for the airway. So let's rethink the findings, and you can read them all there for the sake of time. He's not normal. I mean, there's too much motor activity here. There's odd, weird sympathomimetic stuff going on. I missed it completely. One more physical finding. God forbid I did a secondary survey. I was so panicked about the seizure. Take a look at the bottom of his foot. The Amish farmers, he proverbially stepped on a nail. And B, in that community, they don't immunize. So what does he have? He had tetanus. He was intubated for 3 weeks, trached, made it home without any sequelae. The take-home message in this kid is, do your thing for status, do your algorithm. You're not going to hurt anybody. Number 2, redo everything again when you're not sure. And I can't believe it, in today's day and age, we have to focus on the immunization history. How many of you have families that choose not to immunize in your patient mix? Now, I know it's not my place. I'll tell parents, look, it's your decision to not immunize your child murderer, but it's okay with me. I hate it. All right, I'll leave it out. You can read the rest of it. The more weird the seizure, think metabolics, think poisoning. Okay, that's one thing I would do. The next case, this is a 2-year-old who comes in for 4 hours, who went out to eat breakfast in the morning in top shape, and then came back irritable, lethargic, very sleepy. Everybody else is fine who came back from playing in the backyard, and she's odd, and she's very odd. If you take a look at her, her vitals are normal. She's irritable when you stimulate her. Her pupils are markedly unequal, but they work. There's about a 5 millimeter difference bilaterally between the pupils, and she's hypotonic on the left side completely. Now, this is not okay, right? I mean, this is going to be an issue. So with that in mind, look at her problem list. She's altered. She's got anisocoria, which the parent didn't ever see before in her child. About 12% of the population has anisocoria, but she was not known to have that. And she had focal motor deficits. What is the most depressing part of this case? The depressing part is I'm going to have to call neurosurgery, right? Which is always a positive, rewarding sociologic event. And what are they going to tell me? They're going to tell me, don't intubate before I do my 45 millisecond neurologic exam, which consists of a pen light, a Q-tip, and squeezing some part of the patient's body. So I digress. I got a problem here. Now, this is my favorite slide in this talk. This is the thing that we address in the emergency setting that has to be dealt with immediately. These are emergent events. Could there be a mass effect? This kid went out to play. Who knows what happened? Could she be a meningitic? Unlikely in 4 hours, but it's on the table. Could she have taken an opioid? I only care because I can reverse it. Who is the only patient who will be upset with you if you give them Narcan? A junkie, right? Okay, and I doubt this 4-year-old's a drug user. And then low sugar is always on every list. These are things you got to fix in 10 to 20 minutes for the most part. If you look at the non-progressive causes, and there's the list you've seen before a million times for altered level. Sorry, I don't know if I can go back. Let's see. Please don't go off. Yeah. This is more a grand rounds kind of conversation. I think everybody here knows how to work this up. Just for the sake of ageism, how many people here remember Reye's syndrome? Okay, we don't want to remember that again. But this is the secondary level of your concern. And here's another one of my favorite mnemonics for altered states of consciousness, AEIOU tips. And this actually works. And specifically, my favorite thing for lethargy is intussusception, because I've talked to you about that before. This list does work. A word for people as you get older with mnemonics, you remember the letters, but not what they stand for. It happens. Case progression, this is mortifying for me. Narcan didn't do anything. We scanned her, there wasn't any mass effect whatsoever. The CBC was normal. What's next? Where am I at on this girl? I had to send off pan discovery. Lab results, we tapped her, not a thing, normal cells. Her sugar was 10 on the BMP, SMA7, whatever you want to call it. What in the world is this? When you get a lab back that doesn't make sense, what do? You repeat it. So we repeated the finger stick and it was 0. Not cool. Further history, grandma lives in the home. Is this good or bad? I gave a talk about 10 years ago where I impugned grandparents as unsafe homes for children as a tox talk, and I got a lot of back chatter from it. I'm about to have my first grandchild, and my wife and I are going to have to poison-proof our house, which we got to put the heroin away, you know, the Adderall. It's a sacrifice, but we'll do it. Some of grandma's sugar pills are missing. What are you going to do here? And she got D50 after I spent $47,000 on this sugar kid. And what's the take-home message? Get a bedside glucose in any sick kid. They don't have glycogen. Do it. Anybody who's sick, anybody who's barfing, anybody with an odd neuro, any odd syncope. And in my mind, the A, B, C, D, I talked to you about this before, is dextrostick in kids. Just do it. And you'll be very, very rewarded when you diagnose it. Next case, a 14-year-old boy presents with a swollen ankle for 2 days. 2 days earlier, playing hockey, his lateral malleolus got rubbed in the boot, and he developed a cellulitis in the ankle area, okay? He comes in, and he's not normal. He's tachycardic. Look at his pressure. His temp is 39. His hyperactive precordium, his ankle is obviously cellulitic. Belly's a little tender. He's got marked erythroderma. If you take a look, the ankle is simple. The rash, he was sort of a sandpaper red rash on the skin, which was very warm and very vasodilated on him. But he clearly had a cellulitis, and we were going to admit him for obvious concerns. There's your list, and the erythroderma is a clue, and the soft blood pressure is a clue. It's a clue for staph or strep. And if you go back in time and you think about your staph and strep teaching, the organism has well empowered on its cell wall with toxins that can give you vasodilatation, obviously, and all sorts of toxic shock and other things like that. Staph or strep are on the market. We got blood cultures drawn, broad spectrum antibiotics. I think we put this kid on Clinda, and arrangements were made for admissions. Labs come back, and they're not normal. I expected the white count, but I didn't see the platelets coming. More importantly, why is he uremic with impending renal disease? Normal host. So this is bacterial versus target organs. What am I circling the wagon for? Here's my new problem list. The renal insult, the pressure is down. He's got the redness to his skin. It's coming into focus, obviously. 1 hour later, his pressure's down in the 70/50. And in summary, for the sake of time, he got 60 per kilo of saline. He bought pressors for 5 days. He was ventilated, developed ARDS, recovered uneventfully, and went home with negative blood cultures. What did I miss here? Toxic shock. I bring this case to you because I want you to remember this every day besides sugar. Anybody for strep throat, impetigo, MSA, MRSA, anybody, take 5 minutes of your life, check their blood pressure, and make sure you check all the vital signs because you might pick up somebody with toxic shock syndrome. And I think you're all going to run into this in your careers without any problem. And I'm going to end with this last case because it's one of my favorite twist and shout kind of cases. Okay. A 4-month-old arrives with poor color. His parents has noted his color change, but not one other symptom in this kid. Formula fed, no meds. There's no history here. There's nothing going on with this kid. He's a beautiful 4-month-old. On physical, there's your vitals, there's your temp. His sats on room air are 88%. Okay, that's low. He's got cyanosis everywhere, tongue, subcutaneous nail beds. His lungs are perfectly clear. His heart sounds were like this. That's all I heard, beating. The med student heard a mid-diastolic crescendo murmur. Don't lie. There's your baby, a little off color. What am I going to do? I've got a cyanotic kid. I'm going to look into 3 places, lungs, heart, and other. Okay? I think you know where this is going. We gave him room air. I gave him 100% oxygen because it's free, and I didn't do a thing. His sats stayed low. I got a chest film, normal, UA normal, CBC normal. Here's your diagnosis. On 100%, his PO2 shot up to 300. What does that mean? He can dissolve it, right? He can get the bubbles in the water. He can get the bubbles in the blood. But then his sat's low. He can't carry it. I have just diagnosed hemoglobin disease in this kid, which you know is methemoglobinemia, and Oragel was the culprit. And there are the drugs that can do this. How many of you have ever seen methemoglobinemia? A smattering. Okay, we can go over it later with other stuff. But those are 4 cases. That's how I'd approach them. Physiology saves the day. I'll see you in a little bit. The kid was treated with methylene blue. Thank you.